What I'd like to do, just briefly, is provide a reminder to you of the goals of the People That Deliver initiative and the progress that we've been making up to this point, or rather, that you've been making as part of the partnership together. So I would like everyone who would align themselves as from a country government to raise their hand, please. If you would align yourselves as representing or being part of country government, please look around and see those around you. Okay, thank you. Please put your hand down. If you would describe yourself as being part of an international agency, please raise your hand. An international agency, please have a look around. Thank you. Please lower your hand. Academic institutions. If you're from an academic institution, and including our volunteers who look very beautiful in their UNICEF blue, and students from local universities, thank you. Please lower your hands. Implementing partners. Fantastic. Please lower your hand. Non-government organisations. Yeah, there's a few in there, non-government organisations. And private companies. Fantastic. So hopefully you had a chance to look around to see that these we have defined in the initiative as various constituencies we would like to engage together so we can improve health outcomes by promoting sustainable workforce excellence in health supply chain management. So thank you. What do we mean by that? Well, Benoit gave us the history of the initiative and where we've been, and what's on the screen now is the paradigm, or what we are aspiring to as an initiative, both at global and country levels. I'll let you have a read through the characteristics, but it's interesting when you speak and as we look at what donors have invested over the last number of years, there have been investments in a range of activities to do with supply chains, particularly commodities and warehouses, and lots of training, but systematic investments when it comes to human resources is often one of the last things that donors look at because it takes long term and it's very difficult. The circle on the screen seeks to give you a paradigm of having qualified staff for supply chain jobs, having career incentives to retain them, high staff satisfaction, making these jobs desirable, and institutions to produce them. So this is the paradigm that we're working towards. Benoit mentioned to you this structure that's on the screen. What I would like to do is to ask all the board members to please stand. And just so that as the rest of us can see. So these are your board members. Thank you. Please take a seat. Please feel free to interact with them and ask them questions about the initiative. We've seen our working group leads. Please stand if you are actively part of one of our working groups. Please stand if you're actively part of one of our working groups. We have a core set of individuals and organisations helping us in those working groups. Thank you. These are our 7 focus countries that Benoit referred to. Focus countries in that they were selected at our first conference with government commitment, donor commitment, and technical assistance from the members around us to progress human resources issues. These are the 4 strategic goals of the initiative, which I'll let you read through, but I summarise them as a global level goal, interacting with global organisations to make sure that systematic and professional approaches to human resources for supply chains are considered. Then our second goal is more of a country-based goal where we're seeking to interact with governments to get them to demand to not only have the right personnel with the right competencies, but a systematic approach to human resources to support them to make that a long-term sustainable proposition. Then our third goal is working with a variety of institutions to ensure that they are adequate personnel from relevant cadres suitable for the local context. And then with the variety of activities we have in the initiative, we're generating evidence that we're sharing. For our global recognition, this is something that myself as the Executive Manager and the Secretariat, we've been working very hard on in the first sort of 9 months of my term. Particularly, we've got strong human resources for systematic approaches to human resources in the UN Commission Promising Practices Brief. Small plug, there will be a side meeting for this brief at lunchtime tomorrow in the room next door. Gavi supply chain strategy, which we'll hear in more detail in the last session of the conference, but which we spoke about yesterday, and having leadership and approaches to human resources in the People and Practices Working Group, which Masunda from UNICEF is leading. We've also had opportunity to feed into a WHO report with access to antiretroviral medicines through contacts through Chris, our Advocacy Knowledge Management Lead. And I've also been asked to represent you and the initiative at a range of advocacy presentations that you see on the screen. By looking at the range of people in this room and the extent of emails I get from a variety of organisations, as an initiative, we've done very well at that goal of getting recognition that this is something that's important and needs to be part of the sustainable development of supply chain peace. Our goal for working with country governments, we have 7 focus countries that we work with more closely than others, but I often have country conversations with a range of government officials and NGOs. So please be aware that our door is open to speak to any country. But these particular countries, Burkina Faso, Ethiopia, Indonesia, I'll just tell you a small story, and we're going to hear in more detail this morning about Namibia and Burkina Faso. Burkina Faso, I'd like to point out, is one of the countries that's been able to systematically approach this issue by getting governments to change policies, some of those policies that Giorgio is talking about, in terms of the right people in the right place, the right education offering, and a supportive structure. And I'll leave Jessica to talk to us about that shortly. But in Ethiopia, it's been a very interesting environment with nearly the largest density of supply chain partners and donors working in that environment. Jimma University started a master's degree in supply chain in response to a human resources for supply chain assessment conducted earlier via the initiative. We have representatives here from Addis University that's currently involved in a project with UNFPA, UNICEF, USA Deliver, SCMS, with UNFPA funding to look at the landscape of supply chain education that's offered and how that might be better developed to meet the needs of the counties in the regional parts of Ethiopia. But such an investment can only be of use if that's part of a larger human resources systematic approach. And we're very excited to hear that the government of Ethiopia launched a human resources for supply chain working group earlier this year that's considering these situations. In Indonesia, they've taken a different approach, and they have a PtD Indonesia, so people that deliver Indonesia, and they've used the initiative as an apolitical environment to bring the supply chain partners together, to have a one-gate policy to consider pharmaceuticals as they enter the country. And they're looking at professionalising that human resources piece. Please look in your programs because all of our focus countries are presented in the programs and will give us more detail about this goal. But as we move through this couple of days, I think you'll agree with me that it's what we have to be working the hardest at in this next 2 years of our initiative. We need to be doing better at our country goal. Our third goal of adequate personnel, you'll also notice in your program there is a large section on workforce development. There are projects in many countries looking at strengthening the academic piece, whether it's the Logivac Centre that is in Benin, Burkina Faso Masters, the Jimma University I've mentioned. Namibia have strengthened the offering of in-service training to their pharmacists. A project I was working on before coming to this initiative was looking at developing certificate-level courses for entry-level supply chain personnel. And we have a private partnership with Imperial Health Sciences where they're looking at the Africa Supply Chain Academy by linking private enterprise with private institutions with a suite of education offerings. And Laptop, which is the interface between those who are providing education in supply chain and those who seek it. And this is a reproductive health supplies coalition tool. And again, at lunchtime today in the room next door, we will be having a side meeting for those who are interested, looking at the PSM toolbox, looking at Laptop and IAPHL as 3 tools that supply chain personnel can be using to increase their professionalisation. Tools and resources. There's been a number of what I've been describing as sort of flagship tools and resources that we've been working on as an initiative. In our advocacy tools, and at this point I would like you to take your program, and you will notice that there is a virtual conference pack page, which I just want to draw you to because programs never get read well. Page 10. I'm just going to take a moment on this because I think it's important that you take the time to have a look, because this virtual conference pack is available on our website and available through these links where you can get access to these tools. So we have a series of advocacy tools, series of PDF documents, videos, as well as workshop material that you can be using in your countries, working with your partners to advocate for strengthening supply chain. Our technical guidance and tools that you'll notice there include a couple of key ones for us. One is our Human Resources for Supply Chain Management Assessment Guide and Tool, conducted through USA Deliver with PtD. This tool has now been used in, I think, 15 countries, and forms a basis from which to assess 5 building blocks of a systematic approach to human resources, and has been a baseline of data to help countries develop strategic plans that they've been working on. I'm very excited that that this year, Mozambique, for example, as part of their supply chain strategy, has instilled a human resources component and operational plan that's now seeking funding from the donors. Competency, we've said, is very important, and we have a competency compendium which seeks to shine a light on the need for appropriate competencies in supply chain, with recent application in Namibia. And again, you'll hear about more of that shortly. Funding is very important, and we've developed a funding guide for supply chain managers on how to interact with the top 10 funding opportunities globally. It's a simple 12-page document available from the website that helps supply chain managers understand what's available and gives some hints on how to interact with some of the global partners for funding opportunities. My challenge for you over the next couple of days is to listen and learn from your peers. There is a wealth of information and experience in this room. Please talk to each other, and I would encourage you to attend our networking function this evening. Also, share your story. We, as the Secretariat, are looking for stories, and we encourage you to be sharing your stories with us so that we can communicate those to our other peers. But I think one of the important challenges for today is plan how you will act. What are you going to do as an organisation or as a government to improve where you are to where you're going? And just a little plug that if you're sticking around for Friday, we have a number of rooms booked in this facility that if you would like to have them booked for you, for your organisation or your country, to do further country planning, you would be welcome to do so. Thank you.